Dr. Fatunde, lately in the news, there's lots of news about a particular topic, and that is people falling asleep in the afternoon, having car accidents. They're not drunk. In fact, more people currently apparently have car accidents, having sleep apnea, falling asleep, than there is people drunk. In New Jersey, there was just a guy who wrapped a bus around the ball, killed lots of people, and they suspect sleep apnea. Sleep apnea is something where people stop sleeping at night. They don't quite know it, that they do. They wake up, they don't breathe for 10, 20, 30, 60 seconds. It deprives them of oxygen, of sleep, and they are tired, exhausted. So they go in the afternoon and have a coffee, a Coca-Cola, a Red Bull, or any some such energy drink, and don't know what happens to them. And dental appliances, snoring appliances actually, because most people who snore, not all, but many people who snore also have some form of sleep apnea, apparently. And a dental appliance really can help there, even though the gold standard is a CPAP machine, which basically presses air into the mouth, nose, wherever. And but it's an uncomfortable instrument. Most people can't stand it, except if really, if their health is so bad because of sleep apnea, then they may have no choice because they know they could die. But, most of us are not at that level. We snore, we always feel a little fatigue in the afternoon, and there's some sleep apnea. And apparently, a dental appliance does a lot to that. Now, being an orthodontist, you're used to make appliances, you do things for DMJ and all kinds of stuff. What do you have to say about sleep apnea and what I just said?
Well, apnea, like you say, is a situation where there is inadequate oxygen supply. And because there is inadequate oxygen supply, it simply reduces functionability. Now, in a state of sleepiness, while we are awake, because, we are busy moving around, somehow we get a little more oxygen than when we are in a state of sleepiness. And for a number of people, the sleeping through the night becomes a problem because they do not have adequate oxygen supply. How then can an orthodontist help? The first thing is to come into the orthodontist's office and let us see what's going on. Reduced airway is one of the things that orthodontist helps to cater for, because sometimes a reconstriction of the airspace or constriction of the jaw reduces the amount of air that a person can get in. So you have a number of people who they are really not able to breathe very well. A number of them are mouth breathers simply because of a reduced airway. The way that an orthodontist can help, again, depending on what the problem is. If it's a problem that involves constriction of the jaw, if it's a child, there are orthodontic and orthopedic mechanics whereby by expanding the jaw, that increases the airway or the volume of the airway that's available and increases the amount of oxygen that the child can take in. When the child stops growing in an adult, if the jaw is constricted, sometimes the expansion of the jaw can come simply from aligning the teeth and increase the volume that's available for airway space. Other times it may be more involving. It might involve surgery in order to be able, the jaw is taking care of misalignment of the jaws, but as a byproduct, there will also be expansion in the airspace so that the apnea situation is helped. Is it all cases of sleep apnea that an orthodontist can help? No, I do not believe so. But until we see the patient, it is hard to tell if orthodontic procedures can help a sleep apnea patient or not. So for patients who have sleep apnea, I think scheduling an orthodontic consultation cannot help them. It possibly can help.
Wonderful. So let me ask you this. I mean, very obviously, it's lately that they find out that some of the sluggishness people are having in the, afternoon huge tiredness coming on very fast has to do with sleep apnea. And it's not just that. It's on a long time the brain gets damaged, because very obviously if you for a long time keep not supplying the brain with enough oxygen, it got to have some damage over a while. Now, so let's assume a person isn't really all that bad off, however, thinks that he's getting a little tired, fatigue in the afternoon. He knows he snores because his spouse tells him so. Would it be a prudent thing for him to go and say, let me go to an orthodontist and see whether a simple sleep apnea appliance, which is rather cheap, much cheaper than the big CPAP machine, can help. And then it might or might not help all the way with sleep apnea, depends on us, as you said. It most likely will help as a snoring device, which in itself is probably very good for his or her partner, and that couldn't be a bad thing. It's probably a phenomenal thing. And he will immediately know, because I think with this thing you know immediately whether it works, because I've heard it's like with glasses. If you wear reading glasses, if you wear them, you can read. If you don't wear them, you cannot read. So if you wear a sleep appliance, one of those mouth guard kind of appliance, you wear briefing, and next day you are most likely slightly more alert, if that was a problem in the first place. Is that an analogy which can pass? Like people who snore and feel a little tired, exhausted, go and see an orthodontist, see a dentist with a sleep apnea appliance, put it in, it might fix it. At least you probably snore not at all or a lot less.
I won't exactly say that way. If a patient, who has a sleep apnea, it's advisable coming for an orthodontic consultation so that we see what are the orthodontic components of the jaw and of the dentition. That does not mean that as an orthodontist I'm going to make the patient a sleep apnea appliance. No. You come in and I have to look at what's going on with your dentition, and how is it possible as an orthodontist to help this patient, or it's outside the realm of orthodontics?
No, I do understand that, but my point was, wouldn't it be a bad move to go to an orthodontist, get it checked, and he goes, yeah, this is a simple case of, moving your teeth, your jaw a little bit, and you will be most likely fine, or it isn't. Basically, yes, go and get that consultation. It always starts with a consultation. Right. Even an engineer usually looks at a blueprint before he starts drilling on something. So very obviously, so do you. I mean, that is what I meant. Go there, get checked out, because you might just find a very simple solution. And if it's more, if it's more severe, then be happy that you went also, because you caught something which causes you problem, and don't shoot the messenger if it is more severe and wants more treatment than you think it does. Correct?
Yes.
Good. And do you agree that sleep apnea, is a relatively big problem out there, and people should pay a little more attention to it to try to get it fixed?
Definitely.
Well, all right. Thank you very much, Dr. Fatunde.